Dear Detective Vet, over the last 2 months of this drought, I've been seeing an increase in vaginal and uterine prolapses in my cows, both pre and post calving. And I'm not the only one who's having this problem. I've heard of 5 other farms with the same issue. We really don't understand the cause of such conditions, and we need someone to investigate. I've just lost 9 cows to prolapses in a herd of 600, and I don't think this is normal. Send help! From Farmer Joe. As the detective vet rushes to start her investigation, she begins to think about the possible suspects and causes that could be at play in this prolapse case. She decides to question suspects from her other open prolapse cases. Could it be Professor Plum with hypomagnesemia? An increase in prolapse cases was accompanied by an increase in downer cattle and sheep. A few years earlier, hypomagnesemia was diagnosed in a herd that was receiving ad-lib cottonseed due to poor pasture, and 1 or 2 lactating cows died suddenly every few days. Perhaps it was Reverend Green with hypercalcemia. Cases were seen in herds with a number of cattle going down with hypocalcemia. All cases have involved feeding cottonseed or hulls without the addition of lime. Possibly Colonel Mustard with nutrition deficiency. There were 4 prolapses in 1 week on a property feeding scrub and malaphus to calving cows with a body condition score of 2 to 3. There was also a number of prolapses in ewes under similar circumstances. Motive could lie with Mrs. White and genetic predisposition. It was noted that Herefords have a much looser tension around the rectal and vaginal area compared to Angus breeds. Herefords, Bos Indicus breeds and yak crosses have been heavily represented in prolapse cases. And how could we forget Miss Scarlet with hyperphosphatemia? Two cases were seen in Herefords post-calving. One was on a lucerne paddock with virtually no lucerne left, being fed lucerne hay. The other was on sparse sorghum stubble being fed sorghum grain. Upon arrival, the detective vet must decide if this is a case of vaginal or uterine prolapse. Initial diagnosis can be made through a visual observation. Vaginal prolapses present as tissue bulges from the vulva that are variable in size and round to spherical in shape. These can be as large as a soccer ball or more commonly the size of a grapefruit. The tissue is often pink or red in colour, however it is possible for the mucosa to become soiled or dirty. The mucosal surface is typically smooth and may intermittently prolapse. During her investigation, the detective vet collects a thorough history, performs a full physical exam, and undertakes detailed observation of the entire herd. This flowchart will help her to narrow down the potential mechanisms involved in this case if it is a vaginal prolapse. The distinct visual features of a uterine prolapse involve the presentation of a very large, elongated mass of tissue that is pendulously suspended from the rear end of the cow. The tissue hangs down towards the hock of the animal and is usually a deep red colour. The mucosal surface appears irregular, with the button-shaped structures of exposed placentomes and/or fetal membranes often present. The detective vet now consults this flowchart to determine the potential mechanisms involved in this case if it is a uterine prolapse. Treatment in both vaginal and uterine prolapses begin with preparation and replacement of the organ. In this cow, a uterine prolapse has occurred. Using a calm approach and proper restraint, an epidural anaesthetic should be administered for pain relief prior to treatment. The uterus should be washed and rinsed using warm water, removing visible material while being careful not to further damage the tissue. Towels should be placed under the uterus to keep off the ground, so once cleaned it's not recontaminated. The endometrium then needs to be evaluated for perforations or tears. Full thickness tears need to be repaired using a simple continuous suture pattern with number 2 or 3 cat-cut material. If the laceration has wide radiating areas of traumatized tissue, a vertical mattress suture pattern can be used instead. We can then gently lift the uterus to allow for potential urination. The urethra is often blocked as a result of the uterine prolapse, causing retroflexion, meaning that the cow had an inability to urinate and likely has a full bladder. Lube should be applied liberally to the uterus in preparation for replacement. Replacement should be performed from the base to the apex of the uterus in a kneading manner and held in place. During replacement, the uterus can be wrapped for protection, minimizing iatrogenic trauma. We need to ensure that the uterus is fully reduced. Utilization of a wine bottle is an excellent tool for this. Passively inducing warm fluids into the uterus is another tool to completely reduce inverted uterine horns. Excess fluid should be siphoned out, and oxytocin administered IM will enhance uterine involution. Based on the type of prolapse and severity, we can then look at temporary retention or permanent fixations. Prevention of prolapses in at-risk animals or herds is grounded in management of risk factors. Some risk factors, such as breed and hormones associated with impending parturition, cannot be influenced by management, but many can. Although risk factors are unique for each type of prolapse, preventative measures can be largely grouped accordingly. Firstly, it is important to reduce the incidence of dystocia via genetics, good husbandry, and vaccination against common diseases. Select sires and dams for calving ease and low birth weight, and provide good nutrition to achieve desired body condition scores. Nutrition is also crucial in the transition period to minimise the risk of negative energy balance and hypocalcemia, two gateway diseases that increase the likelihood of prolapses. Farmers must aim to have animals in good body condition at joining and at calving or lambing, allowing sufficient time between parturition and mating to rest and gain weight. Secondly, we must prevent hypocalcemia and retained fetal membranes. Diet is again important here. Design a balanced DCAD diet and minimise calcium intake prior to parturition. Ad-lib feed and supplementary calcium postpartum are recommended. Producers should not manually or medically remove fetal membranes, but rather aim to minimise twins and abortions, which can predispose to retained fetal membranes. Lastly, although surgical correction and prolapses may prevent recurrence, it may also cause injury to the cow at both the present and subsequent parturitions. Strong consideration should be given to culling prolapsed cows after they have calved and either completed their lactation cycle or had the calf weaned.